So overactive bladder, which is often abbreviated simply OAB, it's actually a syndrome. A syndrome is kind of a collection of symptoms. And in this case, the symptoms are urinary frequency, which is urinating 8 or more times per day, or if at night, it's urinating 2 or more times at night. Urinary urgency, which means I'm rushing to get to the bathroom. It's almost like I can't make it to the bathroom. And sometimes we don't, and that's called urgency incontinence. And urgency incontinence is urine leakage, any urine coming out of your body that's just sort of unexpected. It's oftentimes described as a lack of control. And overactive bladder is extremely common. So this is something that affects at least 37 million Americans. And one of the things I always like to emphasize is it's not just disease of women or disease of older people. It affects women more often than it affects men. It affects patients who are older more often than it affects patients who are younger. But I treat overactive bladder in 14-year-olds, and I treat overactive bladder in 94-year-olds. I treat overactive bladder in men, and I treat overactive bladder in women. But it is something that's more common in women and more common as we get older. There are a lot of treatments. And when we think about overactive bladder treatments, we usually think about 3 phases of treatment. So the first phase are often called behavioral therapies. And so behavioral therapies, sometimes you kind of think of them as sort of common sense therapies, but sometimes they're things that don't quite seem logical. So we always spend a lot of time with patients going over these. Behavioral therapies might include changing things that we eat or drink that might be irritating to the bladder. So caffeinated beverages, foods and beverages that are acidic, maybe artificial sweeteners. There are a lot of these things that can be irritating to the bladder. If we eat and drink fewer of them, it may help with our overactive bladder symptoms. There are some patients still, either their symptoms are too severe or they just don't have an appropriate response to medications and behavioral therapies. And those patients will often move on to what are sometimes called third-line therapies or advanced therapies. These are sometimes surgical therapies, and so they include things like injection of botulinum toxin into the bladder. So we hear about botulinum toxin used for a lot of other things, but in fact, common uses of botulinum toxin is actually injecting it into the bladder to treat severe and refractory overactive bladder. There's another type of advanced therapies that are oftentimes called neuromodulation. That's sort of a fancy word that means we're changing the way that the bladder nerves send signals to the brain. So in general, in neuromodulation, what we're doing is putting a little wire or a device right next to a nerve on its way to the bladder, or a nerve root, which is sort of a collection of nerves coming from the bladder and other areas. And by stimulating these nerves with a tiny electrical signal, we're hoping to block some of that urgency signal that's coming from the bladder to the brain. Usually these advanced or third-line therapies are reserved for patients who have tried earlier therapies like medications and behavioral therapy and haven't seen improvement.